Welcome to Health Space 2023. Today, our topic is the psychological effects of, eye problems in general. And today, our resource person is Ms. Padma Anil Kumar. She's the founder director of D.O.R.A.I Chennai. Thank you so much for coming and, being on board with us. She's a trained professional counselor with over 30 years experience in educational, adolescent and child, marital and career counseling, trained by international professionals in modern theoretical pedagogical theories. She is an exponent at TA and the Arts Integrated Learning Programs. She is a UGC NET Scholar of Master's Level Teaching. She is head at institution called D.O.R.A.I, a center of self-discovery that focuses on counseling and outreach training modules for students of all ages. And she has done so much more. Her bio can go on and on. She has achieved so many great things. And once again, thank you so much for being on board, and thank you so much for accepting the offer from the D.O.R.A.I Foundation. A small intro about the D.O.R.A.I Foundation. They are a community-based organization, and they have did an n number of initiatives like Shiksha, Shakti, Sneed, Swast, and one of the initiatives is Health Fest, where we talk about like this year and these episodes that we like the interns that we are conducting is on relating physical ailments to the psychological aspects. So yeah, that's about it. I think we can go ahead with the interview. So like my first question, I did a case study, but since we're going to be uploading this on YouTube, I thought it'll be more, valuable and more impactful if the questions were generalized. So like my first question is like, is there any psychological aspects of, having any eye problems? Is that truly any, psychological, does it take a toll on the person who is, affected with eye problems?
So in the whole body, the eye is the one that actually makes us communicate with other people. Okay, because people with specs will tell you that when they remove their specs, they feel they can't hear anymore. It's like that. So literally that the eye is the one that observes and sends a message, and then we start believing that we should answer it or we should respond or whatever. Because see, touch and all that, we keep our hands to ourselves. We can keep our body to ourselves. But the one that actually searches for information is only the eye. And constantly, it's the eye that receives the messages. So any problem in the eye will automatically make the person not able to respond or not able to express or not able to, because like they say, the eyes are the windows to your heart and everything else. I mean, I don't know about that, but really, okay. So but the point is that the eye is the one that is usually expressive, that tells a lot of stories to people in different ways. So when that is having a problem, it seems it naturally affects the psychological aspect. Psychological, I mean the thinking process, the emotional aspect, as well as the behavior aspect. So it does affect, and more so, like anything else is, I mean, if you can't hear and it is suddenly you can't hear, you understand that you will get it back, or you just understand. But when the eyes goes, you don't know how to do anything. You're not able to do it because we rely on the eyes once you get used to it. So I'm not talking about those who are born having a problem like that. I'm talking about people who suddenly have an eye problem. And I'll give you examples and make you understand what is the psychological impacts of it as we discussed.
Yes. Yeah. Thank you. So moving on to the next question. I'm not trying to generalize anything here because it is, this one thing alone is very case study centric question. So the person who I interviewed, she personally said that like the person, she wore glasses from a very young age. So she personally did not like that experience. Like she told me that she went through a lot of bullying because of the glasses. But then there is a very contrast. Like the other person who I talked to, it was a very opposite impact. For her, people gave her more acknowledgement as, being very studious, and she got a respect because she was wearing glasses. So again, the cases are very different. So like, how does it affect them? Like, for certain people who go through bullying, how does it affect them, like, psychologically? But then there are other people who have a very positive impact for them. So like, can you like contrast and, tell us?
So, see, there are two, three aspects about an eye problem. Now, it can be that your eye is having a problem as a genetic issue. Okay, so many of the consanguineous marriages that have happened have children with eye problems. Now, when you see it as another disorder or a disease or something like that, people actually should just take it like that. But what happens is when you're a little child and you have having specs, now it depends on what kind of schools are there also. So the school, like we tease the nerdy people, we tease the geeks in the class and padaku bache, front benchers. We say all this and we tease a lot. So they do become the person to be teased. So I don't want to call it bullying, but it's an easy target to bully. Cheshmish, Kannadi, Soda Buddhi is all normal words that people usually use. Now, that is in a form body shaming. Definitely, it is a kind of shaming the body, and it's trying to say that it is just the beginning of that. But this has been there time immemorial because I probably represent two generations back, and even from then, or even earlier, my parents also talk about it. That is one issue. But that is not the real worry of a parent or of the teachers or anybody like that. What happens with glasses is that lot of activities becomes restricted because of the glasses. Okay, a lot of activities in the sense your games, your sports. It's India is not a country where we can straight away, do something about the laser technique or some, that's all not easily got by the middle class people. So it becomes a pressure on the parent as to, oh my God, glasses have come in. Now what do we do? How do we get? So that is one aspect. Now bullying is one thing in the school when the child goes there. Now that is a huge psychological block for girls, especially because the cool look goes on. The cool look. Like I've had so many students who told me that they are able to be confident because of the kajal. Now with specs, the kajal is not going to be seen. They are not going to look, and the eyes are really, really can bring out the real beauty of the person, etc., etc. If you have really pretty eyes and all that, but all that is getting curved, and they start wondering. So they usually remove their glasses when they have to take a pic or whatever. And each and every time, if you remove the glasses for a better look, what is actually happening is you're not happy with your face. You're not happy with your looks, which is what? Which is in psychological terms, that is lack of self-esteem. So lack of self-esteem is the grounding or is the base for a mentally healthy person. When I say I'm strong, self-esteem is strong, so I am strong. So a person with an eye problem, the minute, and I'm not only talking about glasses, I'm just going to generalize and talk about all eye problems. The eyes become dry and they start closing and winking their eyes too often. It's a problem. Those who have certain twitches, and if that is a problem, dry eyes, too many teary eyes, constantly crying. It's a huge problem. You look like a silly girl, or if it's a boy, then it's a fancy boy, and etc. There are so many words that people use that they constantly criticize people for. So anything with the eyes, it seems very, very, because that's the way you express. Because tears means for anybody, it is, oh, he's a crybaby. She's a crybaby. She's crying easily. It need not be. It could just be because you have an irritant eye. And they don't understand that. Red eyes. Give me the expression of what is a red eye. Red eye is either you're a drug addict, you're like that, you're like this. So many terms. So the eyes are, like I told earlier, it's the mainstream of expression. As a result, depending on what you see in the eye, that becomes the problem in the person. That becomes the person itself. So that parents are worried about. They're really worried about it. Leave alone the cliched thing that, okay, how will she get married? She will not look pretty. And then there is expenses. Nowadays, specs are not that cheap. It's now you have to wear it fancy. It becomes a fashion accessory. You want other things to it. You have to change it. It goes, fashion goes. You have to wear big one, small one. I mean, I know all the problems you can see. And then it has to be cool. It has to be, so many things. And as you grow older, it's not only about children. It's about as you grow older also the issues are plenty. I know when I treat geriatric patients, they get scared. It's terrifying to feel that this is one thing I had for sure. Will I lose my eyesight? I'm getting cataract. Will I not be able to see anymore? It's really scary. It's scary that they feel that this is the only thing I can do now. I can't run, I can't walk around. All I can do is just about use my hands and I can see. And now I'm seeing a lot of that elderly generation that are dependent on the TV and on their phones. And that is the source of entertainment. I know one nice 60, 70-year-old who's now, it's like an empty nest and they start playing games. And they're like, Padma, if I can't see, how will I play with all those games on my phone? I'll get bored. So we're looking at silly, cute uh, problems, but then they're all psychological and it starts to make the person insecure, starts making the person lose self-esteem, start making this person doubtful about their own, which means lack of confidence, lack of, I can, I will, I should. All this is going to change the negativity. That is where even parents are worried about when they see little children having it. Then, of course, certain careers require good eyesight. The better the eyesight, the more the thing. Like say pilot or whatever. And it's like you're a dream. I mean, every child at some point dreams of becoming a pilot. And then you say that no, I won't be. Even for all your image related, like acting or like news reading, everything. Even now, for example, there's a glare in my eye, and people will say, if the minute they want to take a Instagram page, ma'am, remove the specs. Don't have it because there's a glare in your eye. We can't see what you want to really tell. So, which means that anything that comes up in front of the camera, there is an issue with having a specs. And having said that, nowadays you get lenses. Even that, the use of the lens makes it completely dry, itchy, irritant. You're two-faced. I mean, as the first thing you get up in the morning is you have to go and get your lenses on. And sometimes one small dust, you're not able to do all those, fun things that people want to do. You're scared the lens will fly off, and then you're thinking of the cost, and then you're thinking of so many other things. Many people with these lenses. And in fact, one of my clients, the lens, she was in the glamour industry in the sense in some way, and she said nobody knew I had lens on, and then her lens went into because of some 40 something, and it hurt her eye, and eyes used to become red, and people used to ask what it is, and as a result she had to not take the next project that came up. She said, I can't tell them because then that will become an issue. So I'll rather tell unwell and stay home. So you even lie about your eye problems. You don't want people to know that that you're wearing lens, because it looks like not a cool thing to do. So they can't talk about it. And she had to break off for about almost 2 months, and she was feeling very, very low. Will I ever get my job back? If I stay off the market, will I not be taken back into it? So things like that also happen. So it is psychological, and it is scary.
That
I
is,
hope I've answered it.
yes, ma'am, you did. It's just we are so shocked by real life examples, like how eye problems can actually, make a person this insecure and, like losing a job because you have an eye problem. That's, oh my God. So moving on to the next question, it's about the parents right now, because like, does it take a toll on the parents and the caregivers of the people who have eye problems? Like, we covered the mental, how the psychological aspects of children who are wearing glasses. Right now, I want to cover the aspect of, parents and caregivers. Like, how does it take a toll on them?
So, I had a client who was in class 2 or 3 who had a genetic disorder in the eye, and that parent could never be at peace with the exam system. She had to have all the letters bigger in the question paper. And actually, in the board exam, there is blind, yes, but there is no aspect of an eye disorder like this. They don't, so many of the boards don't make your paper bigger or anything like that. They have a reader, they have a writer, they have all that. They have for dyslexia, they have it all that. But can they make the question paper larger font? That is not there in the board exam. So this child is in class 3, and we said, okay, we will deal with it. We'll talk about it. And he's been having many, because it's congenital eye disease kind of a thing. He's been having operations and stuff like that. So we've been teaching him through through word. We made him, oral teaching, and then writing also. He could dictate and we could write and all that we could do. But at some point, he did his operations and it became much better. And the parent was very hopeful that he would be able to write his exam. But he had a problem of, not being able to write within the lines. He wrote big. Only then he could see it and things like that. Now, things like that. which directly affects the academic system. Any eye problem that affects the academic process is definitely a big worry for parents. And if that is, they don't know that is normal schooling does not understand eye problems as a separate issue. I mean, we beginning to understand dyslexia, we understand autism, we understand that to an extent, and we know what to do about it. But the eye problem hasn't yet come out as this, what to do. Like, so if you're having dry eyes and you start, they don't give you time off for that. They don't give you 15 minutes extra time because your eyes are going to become dry. They don't have that. So yes, there's a lot of awareness that has to come in. We have to get, the letters that go from the psychologist or from the medical department, all has to be revised on these things. That's for sure. That's one. Other problem for parents with children with eye problems is when you have this high powered glasses, etc., etc., there are a lot of jobs that become a huge issue. A lot of problems that are there with regard to even applying for it. People think that you can't do that because the strain on the computer, watching that, seeing minute things, because now there is a lot of detailing that is required. So the specs itself has a lot of errors in it. You get full vision if it is direct, if it is, in line with what you're doing. But the peripheral vision is not very strong in the existing specs, the sides and things like that. So a lot of professions that require that kind of detailing are finding it difficult if they have, and that you can see it in the prerequisite. They'll ask for good vision. So parents are a little worried about that. Then with regard to certain other, I had a few students who were blind and who joined the school, and they were not blind from birth. They were blind because some errors, like they had some kind of a cancerous growth in the optic nerve and stuff like that was removed and things like that. They were very worried about the inclusivity. So children with eye problems, those that meant even if you're having a squint eye or you're having a vision problem or even color blindness, all these parents with small problems like that, they are very worried about the child's independence. Can he do things alone? Can he cross the road like that? Can he do? So such children's parents usually when we call them for, let's say, for a picnic or for an excursion, they tend to become overprotective because they seem to be compensating for the child's lack of vision. So they don't let the child become independent. So it becomes a huge issue for teachers in school and things like that to convince parents that they should become independent. They should be able to come to school and do. So inclusivity is a word that they can't really, parents can't agree with. They are, what do you have? Do you have ramps? Do you have this? They're very, very worried about the inclusive setting. So caregivers are really worried about vision. And you must have heard of night blindness, you must have heard of vision problems because of deficiency. And all of them have a different kind of curve. I mean, it's not like you'll become all right. You'll go to normality. It doesn't say that. It says there are triggers, there are age-related issues. So there is an alarm ringing for the parent. Will it, what if he studies too much in the night? What if he watches too much TV? So what if, and constantly the parent gets overprotective about such children. So eyes are usually the most protected and everybody is worried about it. I mean, we don't think about teeth so much, or we don't think about, crushing our nose with a cricket ball or something like that. But eyes are a big issue. Yes, it is. The parents.
Thank you so much. It completely makes sense. So, like, my next question, I want to base it on the answer that you told. Like, how can, there is definitely boundaries for the children and the parents, personal boundaries. Like, how can the children ask for help, or how can they, tackle all the problems that they go through? And at the same time, how can parents, provide them the space for the children to grow? You just told how parents are really overprotective. So how can, a child who has eye problem, be it even anyone, how can they, establish boundaries for themselves to, to tackle it on their own and become independent? Like, the coping mechanisms and
So I can say that with examples. When you say eye problem and tackle it by yourself, if it is really clinical, I mean, if there is a medical issue, you can't tackle it yourself. You need to ask for help. Now, okay, to start off with, what can parents do? So let's say a baby, a small child, whatever. Keeping a touch in touch with the milestones that are supposed to be reached, not as a pressure, that is at 3 months he must do this, not like that, not like the third, exactly 2 days after 3 months you don't have to get hyper about it, like that. What is the child grabbing, holding, picking, it could be, if the child is not able to do pincer grasp or something like that, if he's not able to do it, maybe it is an eye problem. And thanks to today's world, there are some excellent equipment that can identify these things early. Anything that you identify early will be the best way to do. That is, early intervention is best for any issue. So I request parents to be a little bit more alert. The minute the child doesn't do something, I mean, let's say a child doesn't stand at an appropriate milestone and is delaying that process. It could be because he is not seeing clearly. So he's not getting the confidence to stand. So you may think it's the leg, you may think, but it's always good to check it right through and check the eyes also. Now, having said that, I know I had a student who was 14 years old, and she came one day running to me and she said, "Guess what, ma'am? I'm wearing specs." And I said, "Oh, wow. And why are you so excited about the specs? Tell me more about it." So she sat down and said, "Ma'am, till today, when I was traveling by train, I didn't know that between the poles there were lines." So I said, "What?" I didn't even understand it. And then she said, each of these poles are connected by lines and birds sit on it. So I said, "So what was it all these years? 14 years you were traveling by train. When you looked at those birds in midair, in a stationary position, what did you think?" So she said, "I was wondering how. I thought it was magic. I thought and she has not asked anybody. She hasn't spoken about it to anybody." So from the age of 3, if parents communicate about little things that are there in the environment, you'll probably realize the child cannot see. Cannot, because distance, for example, when you're going in a car, talk about it. Make the child look out, because a lot of eye problems are called as astigmatism. There is one huge issue where you get a severe headache, which is the cylindrical situation of the cornea. Okay, now that you won't know until you start getting a headache when you look at moving objects. So our wonderful kids today are given a phone and they're sitting inside or they're listening to music. They don't bother to look out. So they will never get an astigmatism problem. They won't get a headache because they are looking only at their phone. Or they're listening to music. Their eyes are closed. They're in their own world. They're not going to get a headache. So parents must give the child all sorts of experience. So even if it is color blindness, even if it is, all these things can be in today's world really treated. I'm not saying there are cures, but there could be a treatment by which the child very early knows how to cope. See the words I'm using. I'm not saying they'll become all right, they completely vanish. No, it may not. But you start learning, then what happens? If I can cope, I know how to behave in public. I know, and I'm comfortable with it at a very early age. If I show the signs of not being able to see constantly, people are going to start laughing at me or question me or ridicule me or put me down. But if I learn and I'm confident about the fact that, yeah, I can't see that, but it's okay. If I start saying that early, then I'm confident and I can handle it. So parents must give all kinds of experience related to the eye, related to all sense organs for that matter. Give enough kinesthetic movement, kinesthetic, the aspects of it, so that you realize whether the child is able to coordinate. One of the biggest problems that all psychologists will talk about is hand-eye coordination. Now, can you see that? Because your eye is not capable, your hand will not become capable. Right? Your leg will not. A person who hasn't played football, the leg is not communicating with the ball for whatever reason, but it's actually the eye not being able to see the ball at a particular distance, and it's not telling the leg, "Hey, hello, this is how you should move your leg." It's not telling that. That is the issue. So the problem is not in the coordination of the legs. And if they don't coordinate it regularly as a practice, what happens is the leg becomes incapable of taking the ball and keeping it. So you will blame the child as being introverted, sitting at home, not playing football. You'll say things like that. But actually, it's because the eye could not be trained to give the right signals to the leg so that it can move upon. So parents request you should constantly give all experiences related to the feet and the coordination from the eye to the various parts of the body. 1 second, I'll have to break that.
Yes.
I'm sorry, you have to cut that. Okay. Yeah, so I'm repeating. Parents are requested to definitely give all kinds of experience to children so that they are able to showcase very early in life if there is any problem with their eyes. They're able to give examples of it and parents can help them early. And in today's world, there is treatment, so there's always a better way to deal with the problem. Okay?
So moving on to the next question, there are certain people, like, does a person's mindset or attitude change before and after wearing glasses? Like,
Absolutely, absolutely. And this I've seen a lot in the elderly. As the vision changes from long distance problems, I mean, when it changes from that they can't see long distance, it starts becoming, the minus and the plus. You must have heard of that. So when it starts becoming, they have to look, and there is a kind of specs that they have to wear, and they have to be very careful. It becomes really, it's scary. They start becoming messed up. So a lot of jobs around the ages of 40 and 50, we start not doing. I mean, I'm saying we because, yeah, I belong to that age group. What happens is like, see, peddling a needle or something like that. So yeah, I love embroidery, but now it's a pain. So my attitude obviously becomes like, sour grapes, I won't do it. I don't need to do it. So I change it accordingly. That's one thing. Then, for example, supposing you have to do a lot of traveling and you're getting the headache and things like that related to the eye problem, you start. So the attitude and the kind of zest in mind and the mindset to do things does come down if the eye problem is there. Because like I told you earlier, one of the most important organs in our whole body happens to be the eye. It's the one that gives us our careers, our bread and butter in many, many ways. And if we can't do that, then it becomes an issue for many, many people.
definitely. So very beautifully said. Moving on to the last question, like, can you like give us more, examples from your experience, like about, you are in this field for a long time. So I'm pretty sure you would have come across a lot of different or certain very special cases. So can you like share about them?
So, okay, let's start with little kids. Little children who have eye problems. I told you one that was in the school that couldn't write exams and things like that. Now, there are children who are born out of consanguineous marriages, meaning cousins marrying and things like that. Okay, so when the child was a premature child, and so the last trimester, that is the ninth, sixth, seventh, and eighth, no, from the sixth onwards, 7, 8, 9th month, that is the last trimester, when the child was born in the 7th month. So when that time is not inside the womb and it's not nurtured there, there is a tendency for severe eye problems. Okay. Now, I remember this mother who had come to me and whose child was born at 7 months, and till that child, till we identified his eye defect and problems like that, she was under literally trauma. Her anxiety, her fears, does he have eye problem? Does he have a eye? He's delivered at 7th month. Will there be a problem? I had to calm her down each and every time and say, no, it's not, because you can't really tell the complete, because the child is a baby. So you can't tell distance and all that. And those days, I mean, it's not like all the equipment is available all the time for everybody to do it. Nowadays, it's there. So this was a few years ago. I mean, the child is now 27 or something like that. So yes, so those days, she used to come to me and say, ma'am, I'm really scared. Do you think I should do something? Do you know of something, some other method that I can follow for that? So I'm talking about pre-womb. I mean, literally, the baby in the stomach itself, the parent is starting to get worried. Because the 3rd trimester is not complete, will something happen? So pregnant women should not be thinking and worrying about this. There are tests even for that nowadays. You can be comfortable and find out these things early. That's one aspect that I saw. With regard to kindergarten kids, a lot of children are not able to hand-eye coordinate because, like I told you before, and as a result, it is because of eye problems. So what we first, as all counselors, and advice to all counselors, all teachers, anywhere, when you realize a otherwise mentally healthy child, if there is no interest in focusing, as in looking at things for a long time, paying attention, before you identify it as ADHD, that, this, giving it labels, please get the eyes tested. So if there is a KG child who's not wanting to write, who's not writing between the lines, don't immediately, oh, dysgraphia, dyspraxia. Don't give it those labels. Before you go to those labels, get the eyes tested. So eye problems can be nipped at the bud, can be identified early, and this itself can lead to many other so-called learning disabilities that we see in children. So reading, child may not be able to read well because he's seeing probably the words mixed together. I mean, when you go for an eye test, you see certain alphabets are clear, but the end of that line is not clear. It's dark, it's hazy. Children might be having that problem. As a result, they become unsure readers. So if they're not reading, check that. So I had this client who had this problem where the peripheral vision was hazy. Only the immediate, that is the focused, what we call as tunnel vision was good. So you must understand that. Then nowadays we talk about brain gyms, etc., etc. During a brain gym session for a child, we usually do this in art therapy. Like we make the child, draw things and all that stuff. And we say, look somewhere else and draw something here. Look somewhere else. So that is, you're enhancing the peripheral vision. Now, why do we need peripheral vision? What we must understand is ADHD children, their peripheral vision distracts them from focused thinking. Okay. Similarly, children who want to go into sports, wants to go into dance, that is those who need the kinesthetic intelligence enhanced, they should enhance their peripheral vision. When you're playing cricket, you should be able to see who those fielders are, where they are moving up, are they changing position? Well, if my ball goes like this, where should it be hit, etc. Similarly, basketball, similarly, football. You must know who is to the corner of your eye, that should be sharpened. So when you're practically dealing with vision problems, make sure if the child is even having good vision, if you know that they're going to become dancers, singers. So during my brain gym sessions, there was this child whose peripheral vision was low. And today, very proudly, he says, because we enhanced it and things, he's made himself a very good player. He's actually dyslexic, and so his hand-eye coordination was a problem. But because his peripheral vision was sharpened, he's now a very good player in what he's doing, and he's really happy about it. So that was one of the success stories with regard to understanding eye issues and actually working with them. As you grow older, it's an aspect of self-esteem, of the image that the person is. So many girls and boys would like to give it up. Some of the eye problems you should not put the lens on, you can only use specs. So that becomes an issue, etc., etc. So a lot of counseling happens for children with image issues because of the specs. Okay. And like I told you, career guidance. When we're doing career counseling, we see a lot of children who have an eye problem and say, I want this career. And we as career counselors know that there would be a problem with this. And so we have to guide them accordingly. So a lot of people, we've had to change their so-called career goals and set different goals and make them reach that particular thing. So I think across the panel, right up to school, college, like that age group. Of course, I mentioned the older age group. A lot of people go through this switch from their specs to from the negative to the positive with regard to their lenses and things like that, and that makes them unsure of themselves. Cataract people feel very, very insecure. We've got to encourage them. As a counselor, we've had to deal with a lot of geriatric patients with regard to, should I do my cataract operation at all? Will I lose vision? And things like that. So medical counseling for victims of eye problems at the older generation, at the older age group, is very, very crucial and important. I guess I've answered. Do you want more examples?